Hi everybody again. This is Khattab. I'm continuing with you with the material that I'm studying for the MCCQE. So in the previous video we discussed the colorectal cancer screening guidelines. In this one we'll go through these three screening guidelines. They are simple and easy, and then the next video will be about the cervical cancer screening guideline. So starting with breast cancer screening, what is our target? We target patients who are 50 to 74 years old. We do screening every 3 years, and we use mammography for that. Okay, so 50 to 74 every 3 years using mammography. Moving to lung cancer. In lung cancer, our target is these two groups. So the first group is patients with smoking history more than 30 years of back year smoking history, or patients who quit smoking 15 or less years. So we start screening them at the age of 55 to 74. So in breast cancer it's 50 to 74. Here it's 55 to 74. And here we do it annually, every 1 year, using the LDCT. Okay, so that is lung cancer. Moving on to the prostate cancer screening using PSA. So prostate specific antigen. So in this timeline you can see the age, so 50 years old and then 70 years old. So in these two groups, like the patients who are older than 70 and patients who are younger than 50, there is no evidence that PSA screening reduces mortality. And even for this group, which is between 50 and 70, the evidence is inconsistent of small potential benefits and of harms. So it's according to the patient conditions. So it has to be discussed with the patient. The patient has to know the benefits and harms, and then according to the clinical picture you decide. So this is simply the breast, lung and prostate cancer screening guidelines.